Hi everyone. Today we are going to speak with Dr. Sandeep Batra. Dr. Batra is a senior oncologist with Onco.com. He's a seasoned medical oncologist and has 17 years of experience treating thousands of patients. Among his various specialties, he specializes in breast cancer. He's internationally trained and has authored several publications. Today he's going to speak with us on breast cancer and address some of the questions breast cancer patients have. Thank you, Dr. Sandeep, for joining us. Really appreciate you taking out the time. So the first question that we would like to ask is, what is breast cancer and who are the patients who are at the risk of getting this disease?
So breast cancer is abnormal growth of the cells of the breast, and any female, and for that matter males also, they are also prone to the breast cancer. So any person who has got breast tissue, irrespective of the sex, can develop breast cancer. Since the breast tissue is more in the females, that's why we see more breast cancer in the females, but 1 in 100 cases of breast cancer also develop in males.
So Dr. Sandeep, is breast cancer a hereditary disease? And if so, what tests a family member can undergo to check their susceptibility?
There is some element of hereditary risk in the breast cancer. Incidentally, it runs in the families, but not all breast cancers, they are hereditary related cancers. 6 to 7% of the breast cancers, they run in the family and are hereditary. And any person cannot just walk in to get the testing done for the hereditary cancers, especially breast cancer. If there is some index case in the family, especially from the maternal side of the patient, then there are chances that someone is suffering from the hereditary syndrome, and then we need to do the hereditary testing.
Does premature menopause and infertility in patients increase their chances of getting the disease?
So I would say exposure of the breast tissue to the hormonal cycles, that's the estrogen and the progesterone, that increases the risk. So those females who have got an early menarche and a late menopause, or those patients for that matter who have used hormone supplementation, whether for infertility, for any other reason, they are at higher risk of developing breast cancer as compared to the normal population.
That's very insightful. So the next question is, if a patient is diagnosed with breast cancer, under what circumstances should they undergo genetic testing?
So if a patient has got a family history, as we already discussed, in the form of mother having suffered from breast cancer, maternal grandmother suffered from breast cancer, or if the age of the patient is less than 40 years, or any of the siblings of the patient, whether male or female, had a breast cancer, all such conditions point towards that there may be some risk of hereditary breast cancer, and then these patients should undergo the genetic testing.
What do we mean by hormone receptor status, doctor, and why is it important for breast cancer patients?
So breast cancer cells have, for that matter, normal cells of the breast, they have receptors of the hormones, the estrogen and the progesterone, which are the normal hormones for the females. So whenever the breast cancer develops, in a significant percentage of these patients, there are receptors present on these cells which normally respond to these hormones by increasing or decreasing the cell turnover whenever there is an exposure. But we have exploited this particular part of the breast cancer biology, that whenever these cells are positive for these receptors, which are known as estrogen receptor and progesterone receptor, we try to block these receptors by giving some medicines, and that helps us in controlling the tumor.
So under what circumstances should patient get targeted therapies and immunotherapies?
Hormone therapy is the first targeted therapy that came into the clinical use, but now these days the term targeted therapy and immunotherapy is reserved for something different. So if we call hormone therapy, this is hormone therapy which targets the receptors, and these are medicines, oral medicines, they are pharmacological medicines. As far as targeted therapy and immunotherapy is concerned, they are monoclonal antibodies, which are again a type of drugs used in the cancer therapies. They target the specific characteristics of the cancer cells, and that's the targeted therapy. And we have an HER2 targeted receptor towards, there is a drug called trastuzumab which targets particularly those receptors, and about 15 to 20% of the breast cancer cells are positive for these receptors, and then we use the targeted therapy. Coming to the immunotherapy is a drug which basically improves the immunological attack on the cancer cells by the body. The term immunotherapy, some people mistakenly use this term for those drugs which increase the immunity of the person so that all the infections are taken care of. It's not that. Cancers and tumors, all tumors for that matter, they secrete some substances which decrease the immunity attack of the cancer cells of the persons. So these immunotherapy drugs go and target these particular substances in the cells and then help the body immunity cells to come and target the cancer cells to kill them. So that's what is immunotherapy.
That's very helpful, doctor. So I think in continuation to this, you mentioned that 15 to 20% patients are eligible to get these therapies. But what about other cohorts of patients? Specifically, who are the patients who get triple negative breast cancer and what are the treatment options available for them?
So triple negative breast cancer is one of the most mischievous subset, most aggressive subset of breast cancers, and they are typically about 15 to 20%. 70 to 80% are usually either they are HER2 positive or hormone receptor positive, which because of the drugs available to target them have a better outcome. Nonetheless, triple negative breast cancer, the science is rapidly progressing and new drugs are being found out to tackle these cancers. But as a subset, if we see, they are the extremes. So on one side we have breast cancer patients who have triple positive, that here positive for estrogen receptor, progesterone receptor and the HER2, and the other extreme is the triple negative. So triple positive have a better outcome, rather the best outcome, as compared to the triple negative has the worst outcome. But that doesn't mean that we don't have the drugs. The only thing is the survival is much different between a triple positive or a receptor positive tumor versus the triple negative tumors.
Are there certain cases where patients can omit chemotherapy, and if so, what are these cases?
Definitely yes. If we think about the hormone receptor positive tumors or very small tumors, when I say very small tumors, majority of the time, especially in India, patients come when they are symptomatic with the disease and usually are in stage 2 or 3. Incidentally diagnosed tumors is a more concept in the West and now also picking up in the East. When you go for the screening, which is an opportunity to find out a tumor as early as when it is 5 mm to 1 centimeter. These are the tumors which classify for only hormone therapy and sometimes only observation if there are no other risk factors attached with the tumor. So the patients who have been diagnosed incidentally or on screening with a very early breast cancer, which is within stage 1, may really need not go for chemotherapy, and only hormone therapy suffices in majority of them.
Okay. Once a patient starts their treatment, how long does this treatment last typically?
So I would say it depends upon the stage. A very early stage, the treatment may be limited to only surgery. Come to stage 2, patient requires surgery and radiation therapy, and in majority of the circumstances, chemotherapy and hormone therapy. Similarly, stage 3 also, the intensity of the drugs increases. However, the duration of the treatment, it all depends upon the patient characteristics and the disease stage characteristics. Unfortunately, in the stage 4 disease, there is no fixed number of cycles or the limit. Till the time the tumor is under control or till the time patient is tolerating the treatment well, you continue with the treatment. More or less in stage 2 or 3 tumors, which are more than 60 to 70% of the population of the breast cancer patients, the intensive phase of the treatment lasts for about 6 to 7 months, which includes surgery, radiation therapy and chemotherapy. And thereafter, if they are hormone receptor positive, that is hormone therapy is given for about 5 to 10 years duration.
Okay. After breast cancer treatment, doctor, are there certain cancers that the patients are at a higher risk of getting?
So all the drugs that we use, especially chemotherapies, they have a tendency to cause secondary tumors, but that is usually 15 to 20 years down the line, and there are safety features attached to each the drug. There is a limiting dose of the drug which we usually do not go beyond, so that the chances of developing the other cancers are less. It is seen that in majority of the patients who develop second cancers, they usually are having genetic modifications in their genes, in their genetic makeup, which leads to the development of the new cancers. Like for example, breast cancer patients have more chances of developing an ovarian cancer. Similarly, those patients who have uterine cancers have more chances of developing colorectal cancers. So having said that, I would say it's more related to the genetic default and the genetic makeup of the patient rather than the secondary risk to the cancer chemotherapies.
Okay. Before we end the session, one last question that we would like to ask you is, if a patient does get diagnosed with breast cancer, what would be your advice to them to cope up with the treatment as well as the side effects of the treatment?
So I would say even before the patient is diagnosed, what India needs right now is increased awareness that this disease is totally curable provided we find it in early stage. And unfortunately, if it is diagnosed, the patient should not panic. With the type of treatment modalities we have, almost about 70 to 80% patients, in provided they are diagnosed in early stage, they get cured. So, but the treatment has to be followed. The treatment includes surgery, radiation, and chemotherapy, and they are all four essential pillars of breast cancer treatment. Surgery is a must to remove the root cause of the disease. Then radiation is must, not to allow the disease from coming back. Then chemotherapy to take care of the cells which might have spread into the system, and hormone therapy for the prolonged period to take care of any remaining cells. So, I suggest let's do not panic whenever there is a diagnosis, and adherence to the treatment is the main key. So if you adhere to the treatment, in most probabilities you will get cured and you will be living a normal life.